gonna do a sterile dressing change, wet to dry. And the first thing, remember, what we're gonna do is we're gonna do our forever. So we're gonna check the order, and the order says sterile, wet to dry dressing. Now keep in mind, if it's a surgical wound, the surgeon must be the one who does the first dressing change. We don't touch it until after the order has been written about whether to do a sterile or what kind of dressing change we're doing. This will be a sterile, wet to dry. So we checked our order. We're gonna go in the room, we're gonna knock, we're gonna enter, hand hygiene. We're gonna provide for privacy. We're gonna introduce ourselves. Hello, Mr. Bones, how are you today? And we're gonna do a dressing change today. Can you tell me your name and date of birth? Joe Bones, 1, 2, 3, 4, 5. Okay, thank you, Mr. Bones. Are you having any pain or discomfort today related to your wound? No, I'm not. Okay, and you had it changed yesterday. How did that go? It was fine, thank you. Okay, so now we're gonna set up and gather our supplies. I will need 1 pair of clean gloves. I will need the normal saline that we are gonna use to put in the dressing. I usually have, I like the bins of the 4x4s. Most hospitals, I've never been to a hospital that did not have a little bin of 4x4s. I know you don't have them in your bag. I didn't have them either. But I need something that's kind of waterproof to pour the saline into. So I'm gonna just use this, and we're gonna just pretend. You may have some dressings that actually aren't paper, that have a little container that you can pour the saline in. And then we're gonna use a couple of gauze, okay, at least 2 or 3. When you do a dressing change in the hospital, you don't always know what supplies you need, so you gather up what you think might be needed, and then when you are taking off the dressing, you can further assess. You need 1 of your ABD pads. These are my sterile gloves. I will need sterile gloves for this procedure, and tape. What I like to do with the tape is I get myself a clean space. The overbed table is not the cleanest. I gather it off, I wipe it off, and then I'll tear a piece of tape right along here because this overbed table is not that clean. And I will tear the tape in advance on this other piece so that it's not dirty. Okay, the first thing I'm gonna do then is I'm gonna put my clean gloves on. Okay, and then I'm going to put the bed up, put the side rail down, and I'm gonna expose the wound. So Mr. Bones here, I'm gonna try to provide for as much privacy as we can, has a dressing on. Now you'll notice every time you change the dressing, you must initial time and date. So I can look to see when that last was changed, and I know it's usually once a day or whatever the order says, so I know when it's ready to be changed again, okay? And then after you remove the tape, you're gonna take off the first layer, and I always take a look and see what's here. Is there any drainage? And then this goes directly into the trash. No, you know, don't save it or anything like that. And then these are 2 very expensive gauze pads that we're gonna remove. And it looks like this wound has packing in it. I'm gonna look for any drainage, and then I'm gonna remove the packing. Just 1 piece of packing was used, and the wound looks pretty clean, and it looks like it's healing pretty well. It doesn't look like there's a lot of exudate, but I'm still gonna have to clean it. At this point, I will remove my gloves, as is the proper procedure, and I will begin to open my sterile packaging, okay? I save the gloves for last, and this is usually when you do this skill, one of the things that's the most time consuming. I have my ABD pad, and remember, we're gonna open these as best we can away from ourselves, okay, because I need to be able to pick this up. Now you'll notice I am not putting down a sterile drape. I don't have that, okay? I don't have that in this situation. You may not have it in the hospital. So I'm showing you what you can do. Okay, and then I'm gonna open the gauze, and this is why I like the overbed table, to give yourself some room. Open it and don't touch it as best you can without contaminating anything else, okay? Okay, I'm gonna open the gauze. And I always bring a little bit extra just so that just in case I have a problem. So I have one extra, okay, that I'm gonna go ahead and open carefully and have it ready to go. Now I'm gonna go ahead and open this little bin that I'm gonna use that we'll say has 4x4s in it, and I'm gonna use the same technique, open it up and leave it open sitting here, okay? Now the next thing I wanna do, remember, because I can't put my sterile gloves on and pick up this container, and I need to pour the normal saline. So I'm looking at the label, sodium chloride. It was open on April 1st, so it's not expired. I'm gonna open it. I would need to lip this because it's been opened before. Okay, so I would lip it a little bit, and then I'm gonna pour it right into don't really pour it, but I'm gonna pour it right into this container, okay? Now I'm ready to put my sterile gloves on. If you're out of room, that's okay. Sometimes for the gloving, I use the bed. So you can open your packaging, get your sterile gloves. If you contaminate yourself during this process, just be sure to say something and say, oh, I've contaminated, I would need to get new gloves. Okay, obviously the gloves didn't fit in the packaging, but that's okay. Okay, now the first thing I'm gonna wanna do is I want to clean the wound. So I'm gonna take the gauze that was in the little bin. Both my hands are sterile, so I can touch the packaging. Oh, I just contaminated that one. We don't need it anyway, it's okay. I squeeze it out because you don't want it saturated. Now this is when I use the little, what I call the wonton technique. I make a wonton. All I'm doing is making a handle so that I do not contaminate myself. Made a little wonton, and I go right down the center from top to bottom into the trash. Okay, next gauze. Have I contaminated myself? I didn't even touch the wound, so I still am sterile. Okay, the next piece of gauze I'm gonna do the same thing. I'm gonna wring it out. Okay. I'm gonna make the wonton, and I'm going to do this side into the trash. Okay, third piece, wonton. Now it did kind of come out a little bit of my container. I would need a new packaging, and just be sure to say that. Wring it out, wonton. Into the trash. Now, the object of that, wringing it out, is you don't want a pool of saline in there, okay? Now I have a couple pieces left, and I need to pack it. Now this is where you'll take your piece of gauze and you kind of unwind it, because the packing needs to be loosely packed. If you put it in too tight, it will not form a matrix and assist the wound and the skin to healing. So I can kind of use one hand. Now this is where I might contaminate myself, okay? And I'm gonna use my right hand to contaminate myself. I'm gonna pack that wound, okay? Now this hand is contaminated. I touched the sides of the wound. Okay, just put it behind your back. Okay, now I just have to pick, that one's contaminated. I have to cover the wound with my gauze. And then I'm going to cover it with the ABD pad over the top. Okay, now I'm done. I can remove my gloves, and I will tape it in place. I like to tape it all the way around. Be sure to initial, time, and date it. All right, Mr. Bones, hand hygiene. We're gonna go now, okay? Have a very nice day. Thank you.